Mr. President, I was deeply disturbed several weeks ago to learn of the White House's plan to strip $332 billion in critical funding from the Prevention and Public Health Fund, and to redirect that money to educating the public about the new health insurance marketplaces and other aspects of implementing the Affordable Care Act. Mr. President, no one is more interested in ensuring the successful implementation of the health insurance exchanges than I am. I chair that committee, and I was working again with both Senator Kennedy and with Senator Dodd in formulating these aspects of the Affordable Care Act. But it is ill-advised and short-sighted to raid the Prevention Fund, which is making absolutely critical investments in preventing disease, saving lives, and keeping women and their families healthy. And Mr. President, I just made a slight error. That's not billion, $332 million. $332 million that they took from the Prevention Fund. Last year it was $5 billion, and I'll get to that in a moment. So again, in their raiding this Prevention Fund, not only is it a case of misplaced priorities, it is frankly an outrageous attack on an investment fund that is saving lives by advancing wellness and prevention initiatives in communities all across America. A major purpose of the Affordable Care Act is to begin to transform our current sick care system into a genuine health care system, one that is focused on saving lives through a greater emphasis on wellness, prevention, and public health. I have been saying for 20 years or more that we don't have a health care system in America, we have a sick care system. When you think about it, if you get sick, you can get pretty good care in America. We have the best surgeons and best cancer clinics, and if you're sick, there's probably no better place in the world to be than in America to get cured. But what we're lousy at is keeping you healthy in the first place and preventing illness, preventing diseases, preventing chronic conditions. Every expert acknowledges that we will never reduce health care costs or have a healthier and more productive society until we have a major focus on prevention. However, I have no choice but to conclude that when it comes to prevention and wellness, some people in this administration just don't get it. The Prevention Fund already has been a giant step forward for public health in our nation. Typically, prevention and public health initiatives have in the past always been an afterthought. This means that important community-based interventions often go unsupported. The Prevention Fund, as part of the Affordable Care Act, is making it possible for us to make national investments in evidence-based programs that promote physical activity, improve nutrition, and reduce tobacco use. Now, this is not the time to mention all of the many ways that this fund is already making Americans healthier, but I want to mention just several representative investments that are happening right now. The Prevention Fund is already investing $226 million to reduce chronic diseases, including diabetes and heart disease. Heart disease disproportionately affects women. In fact, it is the #1 cause of death for women in this country. Some 42 million women in America are currently living with some form of heart disease. And the World Health Organization estimates that a staggering 80% of heart disease, diabetes, and stroke could be prevented as a result of changes to smoking, nutrition, and physical activity alone. Moreover, this investment by the Prevention Fund isn't only saving lives, it's also saving money. Right now, heart disease costs our nation about $440 billion a year. $440 billion a year in health care costs from heart disease alone. Now, cigarette smoking kills an estimated 173,000 women a year. If current smoking rates persist, more than 6 million kids living in the U.S. today will ultimately die from smoking. This year, the fund is supporting a second round of the highly successful media campaign called Tips from a Former Smoker. It is estimated that last year's campaign will save $70 million annually based on just the smokers who successfully quit in reaction to this 12-week ad campaign. These ads are extremely powerful and effective. Within 2 days of the first ad appearing last year, the number of calls to our quit lines tripled. So mark my words, these ads are going to save lives. In fact, the second phase of this ad campaign is expected to inspire 500,000 quit attempts and to help at least 50,000 Americans quit smoking forever. Now, the Prevention Fund, that's the $93 million for the anti-tobacco education and support campaigns. As I pointed out, over 6 million kids. If we don't do something about it, 6 million kids today in America will die from smoking. Now, let's talk about the immunization program. The Prevention Fund is investing in immunization programs that protect kids, save billions of dollars in downstream costs. For every dollar spent on childhood immunizations, Americans save $16 by avoiding the cost of treating preventable diseases. Furthermore, by ensuring that all adults get recommended routine vaccines, we can prevent 40,000 to 50,000 deaths annually. So the $82 million that was cut from immunization in the Prevention Fund by the action by the White House could have saved our nation up to $1.3 billion in unnecessary health care costs. Again, this is the very definition of penny-wise, pound-foolish budgeting. Mr. President, investments from the Prevention Fund aren't just at the national level, they're also at the community level. The fund is helping states, cities, and towns to implement evidence-based programs that meet their particular local needs. For example, the state of Illinois has made improvements to its sidewalks and has marked crossings in order to increase levels of student physical activity, students going to school. Because of these improvements, the number of students who are walking to school has doubled. Not only is this good for their health, it's expected to save the school system about $67,000 a year on bus costs. In Florida, the school board of Miami-Dade County will soon implement the Play, Eat, Succeed project in order to reduce the prevalence of childhood obesity among students with disabilities and children in the Head Start program. The project will focus on improving nutritional habits, increasing physical activity levels, and achieving a healthy weight. In California, the Los Angeles County Department of Health has worked with more than 100 clinical teams to provide accessible clinical preventive services to control high blood pressure and cholesterol, reaching approximately 200,000 adults just in Los Angeles County alone. In my state of Iowa, the Black Hawk County Board of Health is working with the local Agency on Aging to implement the Better Choices, Better Health program. This initiative is designed to help individuals who are living with chronic conditions to find practical ways to self-manage pain, fatigue, and to make healthier nutrition and exercise choices, to set realistic goals, to understand treatment options, and communicate with family and health care providers about their condition. Now, I mention all these to show that the Prevention Fund is not just some top-down from Washington. We are trying to encourage communities, cities, towns, counties, and yes, some states, to do things on their own, to come up with innovative ideas on how to encourage people to live healthier lives, to prevent smoking, to, for instance, getting more kids just to walk to school. This is a big problem. A lot of kids in America can walk to school, but they don't have sidewalks. They don't have safe passages to school, so they take a bus. Simple things like that are done on the local level with the Prevention Fund. And when local levels experiment and do things like this, and they find that they work, then other people adopt it. To me, this is one of the key elements of the Prevention Fund. It's sort of letting 1,000 flowers bloom, getting more ideas out there from people at the local level on what they can do, how they can buy into this. to have a good prevention wellness program on the local level. Now let's look at the return on investment. We always wonder about return on investment for the kind of money that we spend in government. Well, the Prevention Fund all across America is investing in proven, locally developed programs, as I just mentioned, that promote health and wellness, and they save lives. Not only is this improving our health outcomes, but it will save us money. According to a study by the Centers for Disease Control and Prevention, programs like the National Diabetes Prevention Program could prevent or delay nearly 885,000 cases of type 2 diabetes, saving our health system about $5.7 billion over the next 25 years. The National Diabetes Prevention Program is a public-private partnership of health organizations that work together to prevent type 2 diabetes through lifestyle change programs right in our home communities. And given that in 2007, diabetes alone accounted for about $116 billion in direct medical costs, it's all the more critical that we continue to invest in proven programs like this. Well, I wanted to just point out that for just these investments, for every dollar that we put in a childhood immunization series, it's been proven we save $16.50. Yet, if I'm not mistaken, the White House is taking about $85 million out of this fund. Penny wise, pound foolish. Tobacco control programs, for every dollar we invest, we're saving $5. Chronic disease prevention, every dollar we save $5.60. For workplace wellness programs, $3.27 for every dollar we spend. Any way you look at it, in all these programs, just the return alone, not mentioning the productivity of people who are healthier, who don't smoke, who don't have chronic illnesses, their productivity is much higher than those who have chronic illnesses. So the list goes on and on. The Trust for America's Health released a study showing that a 5% reduction in the obesity rate could yield more than $600 billion in savings on health care costs over a 20 years. Now again, this is the Trust for America's Health. A 5% reduction in the obesity rate, 5% only, could yield more than $600 billion in savings on health care costs over 20 years. And again, studies like this just confirm what common sense kind of tells us. Your mother was right. Prevention is the best medicine for our bodies and for our budgets alike. That's why nearly 800 organizations have spoken out against against misguided efforts to slash or eliminate the Prevention Fund. Mr. President, despite ill-advised efforts to cut or eliminate the Prevention Fund, most Americans understand what is at stake. Prior to creation of the Prevention Fund, for every dollar spent on health care, 75 cents went to treating patients with chronic diseases, while only 4 cents was spent on efforts to prevent those diseases. Again, before the Affordable Care Act, 75 cents of every health care dollar was spent on treating you after you got sick. Only 4 cents was spent on preventing those diseases. This chronic underinvestment has had devastating consequences. Nearly half of American adults have at least one chronic condition. 2/3 of the increase in health care spending between 1987 and 2000 was due to increased prevalence of chronic diseases. We just had a briefing from 3 highly acclaimed medical practitioners a couple of weeks ago, 2 or 3 weeks ago, pointed out that 2/3 of the money that we spend in Medicare goes for treating chronic illnesses. 2/3. So when we talk about the money we're spending on Medicare and how do we control Medicare costs, some people say, well, you just got to make it tougher for people to get Medicare, or you got to cut down on Medicare, when the answer is staring us right straight in the face. Prevention, wellness programs, now and for elderly people who do have a chronic condition, there are interventions that will save us money and make their lives better through prevention and wellness programs. We know that. There are evidence-based programs proven to work. So the Prevention Fund gives us an unprecedented opportunity to really bend the cost curve by jump-starting the transformation of America into a true wellness society, a society that focuses on preventing disease, saving lives, and saving money. So as I said, the fund is doing both. It's saving lives and saving money. To slash this fund, as the White House intends to do, is bad public policy and bad priorities. To take money from the Prevention Fund is to cannibalize the Affordable Care Act in ways that will both cost us money and lives. I think it is a violation of both the letter and the spirit of this landmark law. Now, Mr. President, one more time. We know that prevention saves lives. Cancer deaths. About 567,000 people die from cancer annually in the U.S. 50% of those, 50% is preventable. Preventable. And much cheaper than all the long-term care costs, not to mention the devastation that happens in families' lives when a parent is lost to cancer. And preventable diseases, heart disease, diabetes, and stroke. About 796,000 people die from heart disease, diabetes, and stroke annually in the U.S. 80% of those are preventable. Preventable. And yet, we're going to cut money from the Prevention Fund? Well, it just doesn't make sense. Prior to the Senate's adjourning for this last recess, I put a hold on Ms. Marilyn Tavenner's nomination to serve as administrator of the Centers for Medicare and Medicaid Services. Ms. Tavenner, in her role as acting administrator, signed a directive in March that channeled critical funds away from prevention. So, and I must say, as the chairman of the committee and as the author of the Prevention Fund and the Affordable Care Act, I was never notified of this. I was not consulted on this. No one was. It was just sort of signed away. I want to make it very clear. The hold I put on Ms. Tavenner was not a secret hold. In fact, I don't believe in secret holds. Too often, I think people put secret holds and you don't know who's doing it. I would never do that. I issued my hold publicly. Why? In order to heighten public awareness of this administration's ill-advised policy decision to cut prevention money, and hopefully to get the White House to start to reconsider this. I wanted to give people in the White House the chance to understand that their assault on the Prevention Fund is short-sighted and destructive, and to perhaps suggest other sources of funding for implementing and overseeing the marketplaces. Last year, the administration, as I said, approved a $5 billion, and I am correct here, it was $5 billion cut to the fund as part of the middle-class tax bill. That was last year. And I thought that after that, we had an agreement that that was not going to happen again. A clear-cut agreement. Now the administration has made it clear they intend to move forward with even more cuts, $332 million this year, to the Prevention Fund. So what we are seeing from the administration is at best mixed signals, and at worst, a betrayal of the letter and spirit of the Affordable Care Act. Again, I repeat, this is bad policy choices. This choice to take money out of the Prevention Fund will have serious negative consequences for the future health of the American people. Now, I don't know. I'm unsure as to who is giving advice to the president on this. But I want to say, President Obama, I think you're getting bad advice. Bad advice on this. on where the money is coming from and how it's affecting the prevention fund, and that there are other sources of funding for the marketplaces other than the prevention fund. So again, I want to make it clear, I don't want to interfere with the important work of the Centers for Medicare and Medicaid Services. I also happen to believe that Ms. Tavenner is very well qualified and strongly qualified to be the next administrator. And I believe it is urgent to have an effective leader at the helm of CMS as we enter a critical stage in implementing the Affordable Care Act. Accordingly, Mr. President, I am removing my hold on her nomination. However, as I do so, I repeat, it is deeply disappointing and disturbing that the White House once again is raiding the Prevention and Public Health Fund. And I would hope that Ms. Tavenner, in her future role as the head of CMS, will understand that while she works for the President, that advice and consent from the United States Senate might be something worth considering in her future actions. I hope and expect, again, that the White House will respect the intent of Congress in creating the Prevention Fund, not as an afterthought, but as a critical feature of the Affordable Care Act, every bit as critical as the exchanges, the marketplaces, and everything else. I hope that the administration will join with us in fighting for the Prevention Fund and in making smart, evidence-based investments in prevention and wellness. This is what real health reform is about. It's not about how you pay the bills. If that's all we're going to do, if all we're going to do in the Affordable Care Act is jiggle around on how we pay the bills, we're sunk. We're sunk. Real health reform is about changing our society away from a sick care system to a true health care system, keeping people healthy, promoting wellness, having prevention programs at every level of society, in our schools, in our workplaces, in our communities, from the earliest moments of life for immunization programs to those who are elderly, who may have a chronic condition, but who can control that at less cost and have healthier lives through good prevention and wellness programs. That's what true health reform is about. And it's our best bet for creating a healthier and more prosperous nation. So to that important end, the Congress and the White House should not be working at cross purposes. We should be working together. So again, I say that we must rededicate ourselves to the great goal of creating a reformed healthcare system that focuses a major focus on prevention and wellness, and does it not just for a few, but for all Americans. That's what the intention was of the Prevention and Public Health Fund. And again, Mr. President, again, as I say this very clearly, I don't know who's advising the President on this. But I think the President's getting bad advice. Now, again, I understand the President has a lot on his plate. Everything from Syria to Afghanistan to, well, a lot of stuff. I understand that. But I would hope that again, that those in the White House who are advising the President would take a closer look at this, find some way of replenishing that $332 million, and hopefully making some ironclad agreements that they're not going to raid the fund again next year. See, I thought we had an agreement that last year was it. That $5 billion was it. Well, I thought we had that agreement. I was operating under that assumption. Well, will we just take more money out of the prevention fund again next year too, to meet some exigency that may come up? That's what's been wrong with our sick care system in the past. We're so focused on paying today's bills, we don't focus on the future and how to keep people healthy. So we just pay today's bills, we just keep paying the bills and paying the bills. And like clueless dodos, we wonder why healthcare costs are skyrocketing. It's because we don't focus on keeping people healthy in the first place. So, I will remove my hold on Ms. Taffner. But I hope the administration will find a way to replenish that $332 million this year and really make a firm commitment to not raiding this fund in the future.